Welcome to Long-Term Care Policy and Management. This is Public Health 626. This is your Week 11 video. The topic this week covers two things: leadership, services, and culture. So these are two different topics, but they do overlap in that I think the leadership of long-term care is one who sets the path for the culture of long-term care facilities or home care. We're going to look at long-term care leadership and culture change specifically. So the book gives you a real overview of leadership, and I think it is important to look at that leadership criteria. You probably have seen this leadership criteria and overview in other courses, but I think it's just helpful to highlight, especially before we start thinking about leadership in the long-term care model. Long-term care leaders have to understand a lot of complexities. So as you know through this course, there's a lot of different things, different rules that aren't necessarily intuitive. So I want to highlight what the book calls expert power, because I think that is one of the most important things in leadership and long-term care, is that others follow a leader if that person is seen as an expert in the particular topic area, so long-term care. This can be really important in long-term care because you have both a lot of clinical and non-clinical staff. So what makes a really good long-term care leader is that communication is really important, because long-term leadership involves leading not only doctors who have gone to school for many, many years and are really pretty independent in all the decisions they make, to maybe like janitorial staff who, or maintenance environmental staff who, did not attend 10 years worth of schooling and are not probably fully independent in the job. They do need leadership in terms of what they're going to do from a day-to-day basis. So long-term care leaders really have to have a communication style that can lead everyone in that spectrum of employment of long-term care, and that can be difficult. Other factors I just wanted to highlight was this isn't leadership of just a clinical model. So long-term care leaders usually have a difficult time if they come from hospital leadership, because it's quite different. It also involves that psychosocial component. If you're a leader at the hospital, a lot of times the patients are in and out more frequently, but the leadership at a long-term care facility involves that residential living component, which kind of changes the scope of what you need to lead on. So there's other factors that play into the leadership role. Not only are you a leader for making sure the care is good, but making sure that people's livelihoods are good and that they are living to their fullest when they're not getting care. Two other really important features of leadership in long-term care are negotiation and mediation. These often come into play in long-term care setting for leadership because, again, patients live at the facility. There's a lot of other factors like payment sources, the various payment structures, either from Medicare, Medicaid, or private insurance. And a lot of times administrators are involved in that conversation. And as we know, it's really expensive. So a lot of times those negotiation and mediation skills come into play. Other examples are when residents and staff have conflicts, or residents and other residents have conflicts. Usually the leadership is the one who would mediate or negotiate that relationship. Often, if two residents don't get along, both the residents have a right to stay in their home. So that relationship has to be worked on. And there isn't necessarily a therapist in the building or someone who would have those mediation or negotiation skills. Also, just want to touch on culture change. Culture change is a really important topic in long term care. It's been pushed and discussed really for the last decade as something that all long term care needs to go through. The book brings up that there's two types of culture change, the residential culture change, so going from the medical model of care to more of a living model of care. I think that's the one that we would focus on for our purposes. There also was a push for corporate culture change in that long-term care should go through a change so that they're not modeling the exact same type of corporate and employment styles as hospitals, since they are so different. Culture change is about making long-term care more about living rather than a clinical model. I added a greenhouse project video under the lecture tab, and I think that's just a really good example to explain it. There's a little blurb, I believe, in the text as well. I think that just gives a really good example of what culture change in long-term care is. One of the things I really want you to think about, though, is culture change like greenhouse sustainable? We know how expensive long-term care is, and one of the things we've talked about a lot is how are we going to pay for it, especially with baby boomers coming in. So think about if we changed the culture of long-term care, how does that affect cost? So there's a couple videos under the lecture tab that you should also try out. You have your outline due this week, which is just basically an outline getting ready for your paper. As always, I'm here for your questions, comments, or concerns. Good luck and have a great week 11. Thanks.